Good morning, and thank you for joining us to introduce the NHS in Care Volunteer Responders Programme. My name's Oliver Clark. I'm one of the project managers with the programme, and I'm joined by colleagues of mine today.
Hi, good morning. My name's Jen Scott. I'm one of the other project managers on the programme.
Hi, good morning. My name's Sarah Jane McAteer. I'm one of the volunteers for the programme.
So it's wonderful that you're able to join us to explore the NHS in Care Volunteer Responders Programme. I just want to give you a little bit of background as to what the programme is and where the programme's come from. So the NHS in Care Volunteer Responders Programme started as a direct response to COVID and to the shielding populations throughout COVID. It was there to support our communities and support our NHS. And it's got some real unique differences from most volunteering programs. The first being that it's a digitally delivered program. We deliver it alongside our partners, Good Sam, and it's delivered via your mobile phone. We're there with the emphasis of supporting our NHS and supporting our communities and really looking at how we can do that to further the people within our communities. And because of the unique nature of how our partners, Good Sam, work and the app works, we're able to dispatch volunteers from home. You're able to undertake volunteering from home, and that's all done in a very interactive and digitally enabled way. And because the programme is pan-England, we're able to make sure that we are representative of the communities that we seek to support. I think it's key that we really reflect on what our volunteers and what the programme has delivered today. And you can see that we've delivered over 2.6 million tasks. We've delivered 380,000 vaccination stewarding sites. So that's where our volunteers were critical to the COVID vaccination, turning up and supporting those sites with the stewarding of patients waiting to have those vaccinations. And overall, we've been able to support in excess of 211,000 individuals since the programme started.
So I'd really like to talk to you this morning about our telephone support that's available right now for you, your friends or your family. We all know that a phone call can make a huge amount of difference. That friendly listening ear, the opportunity for a chit chat and a catch up, whether that's about who went out of Strictly on Saturday night, what's being cooked this week on Great British Bake Off, the football scores, or the turning of the leaves on the trees outside. Those volunteer phone calls are available to you or the person you love or care for right now. There's two types of phone calls. Our check-in and chat calls are a service available for up to 18 weeks, and a different volunteer would call you each time. It gives you a great chance to have different conversations, to reminisce or chat with different people from across England at a time that's convenient for you. Our companionship calls offer is the same volunteer giving you a call for up to 6 weeks. You'd decide along with that volunteer on your first call how many times a week you'd like to receive those calls. That could be 1, 2 or 3 times. That volunteer would continue to ring you for the 6 weeks, and then your support would end. We've got a case study there, somebody who's received these phone calls on screen and tells a little bit about their story. But I'm going to invite Sarah Jane, who's made lots and lots of phone calls as a volunteer, to come on and talk about her experience. So Sarah Jane, can you just give us a flavour of what people have talked about when you've given them a call?
Okay, well, the main thing we talk about is what's going on that day, how are they feeling, and then really it's just up to them as to what they'd like to talk about. I've talked to lots of different people from all over the country, and it's just really nice for me as a volunteer to have that contact. And we often end the call with them saying, you know, you've really made my day. It may be that you're the only person that they've spoken to that day. It's always good, always different. But always really interesting to just make that connection and know that you're making a difference.
Fab. Thank you very much. We're going to hear a little bit more from Sarah Jane later on in our live today. But I'm going to pass you back to Oliver to look at how you could access that support for you, a friend or a neighbour.
Thanks, Jen. I think it's really important to say those calls are available from today. A referral into the program for yourself or for somebody you love can take 2 to 5 minutes. It can be done in two ways. You can call our support team on 0808 196 3646, or you can log directly onto our referral website and you can make a referral online. And simply the process is you put the details in for the individual that requires that call. That will be accepted. That will go out to our volunteer base, of which we have in excess of 43,000 volunteers waiting to support. A volunteer will pick that task up on their phone and they will simply call that individual, have that friendly call that Sarah and Jen have just so wonderfully illustrated, and then the call comes to an end. If that's check-in and chat, that will be, as we say, could be a one-off call, or it could be a series for up to 18 weeks. Or if that's our companionship calls, that can be up to 3 times a week for up to 6 weeks. But to request that support for yourself or for somebody you wish to refer, you can simply call our support team, or you can go onto our website. You can also go onto NHS Care Volunteer Responders website, and you can find out more about those activities there. We just want to move on to really talking to you about the other side of the programme. So we've talked about how you can gain support from the programme, but we'd like to talk to you about how you can also volunteer with the programme and how you can get that sense out of volunteering as well.
Thanks, Oliver. So I'm happy to talk us through the different types of volunteering tasks that people give their time to across England. So we've talked about telephone support, making those friendly phone calls, being that listening ear and having a chat with people who are isolated or perhaps just feeling a little bit lonely. We always need more telephone support volunteers, and it's a great flexible piece of volunteering that you can do from home and you can do easily, perhaps in your lunch break or of an evening. Community response tasks are assistance with picking up essential shopping or prescription delivery. These would again come through on your mobile phone, and you could look to pick up that task in advance and plan that around your daily or weekly activities. Perhaps picking up some bread and milk for someone who's being discharged from hospital at the same time as doing the food shop for you or your family. Community Response Connect. It involves supporting somebody to connect into their community, to attend an activity, to go out for a walk, to grow their confidence in going down to the cafe for a cup of tea. So connecting into the community through joining in an activity or just a social time outside of the home. Pick up and deliver is a growing activity for us, and that's a direct support to the NHS. We're supporting with the delivery of medications after somebody has been discharged from hospital. So where the patient's already gone home and their medicine follows along afterwards, or medication or monitoring equipment being delivered or collected from patients who are being supported on a virtual ward, so being cared for at home, but under the care of the main hospital. Those pick up and deliver tasks are generally shifts planned in advance, and our volunteers like that flexibility of being able to go on their phone, choose what shift they're going to do and pop their name to it. In most cases, pick up and deliver is carried out by volunteers using their own car, but in some parts of the country, London especially, we see people fulfil pick up and deliver tasks by public transport, and we see people deliver those tasks sometimes by bicycle or using their motorbike. So there's lots of reasons people volunteer with us. Sometimes that's about having purpose, having meaning, having something to do. It's a really flexible volunteering programme that fits around your lifestyle, whether that's about managing caring responsibilities, looking after your own health condition, or fitting alongside children, work, and everything else that you've got going on. Because you use the Good Sam app to pick up the tasks that you want to undertake, there's no pressure to do consistently the same thing week in and week out. You might do 3 or 4 tasks this weekend and nothing until the middle of November. And that's absolutely fine. That's the flexibility that this programme affords. You're able to pick up and choose activities that match your interests. That might be volunteering in person at our vaccination sites, supporting your community, or volunteering over the telephone, perhaps while you're waiting for children to come out of a club or a group in the evening when you're sitting in the car. We have training and support that wraps around our volunteers, and our support team is open daily, 8 till 8, 7 days a week. That's exactly the same for doing that self-referral Oliver mentioned earlier on in our session. 7 days a week, so you can call our support team on a Saturday or a Sunday. Any out-of-pocket expenses incurred because of your volunteering are covered by the programme, and you just make a simple claim each time that you need to draw down on those expenses. I'm going to come back to Sarah Jane, who's been involved with the programme for a good number of years. And I'm going to start off with a quick question, if I may, Sarah Jane. What keeps you volunteering? Why have you stuck with us?
I just really like the conversations, basically. So I started, like you said, I started back in the pandemic when I had a lot of time to spare. I'm also somebody who had been quite unwell in the years before the pandemic. So, and I always valued the conversations I had when I encountered people in hospital that made a massive difference to me. So I was aware of what that kind of input can have. So that's why I started. I did quite a lot in the pandemic. Since then, my life has changed a lot, but I've been able to take the program with me because it's so flexible. So I don't do a set number of calls per week. I sort of pick them up off the system as and when. But sometimes when I feel like I haven't got a lot of energy, but I still want to actually be talking to people, using my brain. So yeah, that's me really.
Fantastic. That's great. Thank you for sharing that experience with us. Oliver, am I okay to pass back to you to find out how we can get started as a volunteer if we want to sign up?
By all means, signing up as a volunteer for the NHS and Care Volunteer Responders Programme has never been easier. It takes approximately 5 to 10 minutes maximum to sign up. And you can do that by visiting our website at nhscarevolunteerresponders.org. And simply all you need to volunteer is to have access to a smartphone, to be over the age of 18, and to live in England. We then ask you to complete a couple of assurance checks, for an example, an ID check, of which you'll need some government issued documentation or a national identity card. So simply, you'd need to go to nhscarevolunteerresponders.org, and you can click on the tab that is I want to volunteer. From there, it will take you 5 to 10 minutes to sign up as a volunteer. And within 10 to 15 minutes, you could be picking up your first phone call as a volunteer, as Sarah Jane has just outlined.
Oliver, we have had a question come into the chat, which is what happens after I've registered as a volunteer? So what happens next?
So after you register as a volunteer, you'll then be able to download the app. So you would go to where you get your apps from, be that the Google Play Store or the Apple Store, and you will download the Good Sam Responder app. From there, you will enter your details that you've just signed up with, and you will be able to pick up your first shift, your first phone call there and then, following the completion of your ID check. So you simply register, you complete your ID check, you download the app, and you'll be ready to volunteer. The website is available to you at any time, and that's where all our guidance is around how to undertake those activities. So each activity that Jen has just spoken about has what we call a Getting You Started guide, and that's what you need to know to be able to undertake that activity. And that's available on our website at any time. There's also a lot more information to guide you through how to undertake those activities. We've got a section called Skill Bank, and that might be where you will find those conversation starters. People might have trepidation the first time that they undertake a call. Our skills bank is full of a lot of hints and tips and such things that will help you and support you. We've just got a question come in about DBS checks. You can do a DBS check within the program. So we've got roles that are available to volunteers that just want to do something from their home whilst just undertaking an ID check. But some of the roles that Jen's just mentioned, getting out into the community, supporting people with our community response shopping and things like that do require a DBS check. Again, that's all undertaken from the Good Sam website. That's the website, the platform that is accessible via a desktop browser. You can click to complete your DBS check there. And once that's complete, that'll unlock even more roles that are available to you to be able to support. So I just want to really recap on why people volunteer. You've just heard from Sarah Jane about her experiences. But through talking to our volunteers, we're able to give you some statistics about what volunteering means to volunteers. So 70% of people really express that they have a greater sort of belonging within their neighborhoods, within their communities, because of the volunteering that they undertake. 64% feel more integrated into the communities that they live within. And 74% have greater trust in our communities. And that's just some of the scale that volunteering and connecting to your community by supporting others has really shown and demonstrated within this program. But it's not only volunteers that have that sense of belonging, that have those outcomes. We also are able to show the impact of volunteering. And on screen here, you'll see the impact that the NHS and Care Volunteer Responders Programme has had on our greater community, our health service, and others. So you can see that 42% of people state that they have visited their GP less often, which has a real impact upon our primary care services. 36% attended A&E less often, again, having such an impact on our secondary care and acute healthcare providers. So you can really see that the impact is not just for the individual that's receiving that support, as we've heard from that testimony from our patients. It's not just having the impact and sense of belonging for our volunteers, but it's having a greater impact across our healthcare systems and our communities.
Oliver, we've had another couple of questions come in. So Julie's asked, do volunteers have to do tasks every week? And I think Sarah Jane covered that off. But Oliver, can you answer that one for us?
Very simply, no. The program is flexible. It gives you the control over your volunteering. As we've said, the volunteering takes place via the Good Sam app that is on our smartphone. You can go on there and you can see the tasks that are available for you to undertake, either now or days and weeks in the future. And you can pick and choose to suit your lifestyle when you volunteer.
Fantastic. And another question's come in from Catherine. I'll take this one. So Catherine's asked, does it take a long time to go through the information to prepare before the calls? So the information that you'd see about the person on the Good Sam app is quite simply their name and that they need a call and their telephone number once you've accepted that task. We recommend, and you've had signed the expectation when you sign up as a volunteer, that you're going to read the Getting Started guides. They're nice, short, bite-sized chunks to work through on the website, and that reading is probably about 20 minutes to get yourself sorted before you make your first call. So what I'd say is, Oliver mentioned, it's a quick sign-up process that can take just 5 to 10 minutes to get signed up. You could read the guides and be up and ready and making your first phone call this afternoon to somebody. However, if you're the sort of person that wants a little bit more support, there's welcome webinars. They're an hour on a Teams or a Zoom type call. We normally have a member of our programme team and a volunteer, just like Sarah Jane, along there to give those hints and tips to become more familiar with the programme. Those welcome webinars are optional, but are really actively encouraged to attend, and volunteers give great feedback that gives them the confidence to grow in terms of their volunteering. Throughout the weeks and months, we also learn more about webinars, and that's about the different types of tasks. So if you start off doing check-in and chat telephone calls, and then you want to do a little bit more, you've got the reading, but you can also pop along to one of those shorter webinars, 20 minutes or so, about community response, just to make sure that you know everything you need to know before getting started.
So we're coming to the end of our presentation. So I just want to really recap. So to get support from the NHS and Care Volunteer Responders Programme, to receive those phone calls for yourself, your friends, your family, your loved ones, you can simply call our support team on 0808 196 3646. Or you can make that referral yourself online via www.goodsamap.org/NHS referral. That will take between 2 to 5 minutes, and those calls could be starting from tomorrow or whenever you see fit. That's check-in and chat for up to 18 weeks from a different volunteer each time, or companionship calls up to 3 times a week, up to 6 weeks from the same volunteer. So that's how you would request support from our service. And simply, if you wish to volunteer, then you can simply go on to nhscarevolunteerresponders.org and you can commence your application there. All you need is a smartphone, to be over 18, to live in England, and have some ID documentation to undertake those checks.
Oliver, have you got time for one last question that's come in?
By all means.
Fantastic. So Catherine has asked what to do if I'm worried about the person I've called.
Yeah, so Jen illustrated before some of those support mechanisms that are available. We have a support team that's available from 8 o'clock in the morning until 8 o'clock in the evening. They're there to support yourselves as volunteers throughout the life course of your volunteering. So simply, if you have any concerns at all, call our support team, and our support team will be there to be able to talk you through the processes and be able to support both yourself and anyone that we make contact with through the programme. So simply call the support team for any support you need.
That's great. Thank you very much. And then Mags D's asked, can people re-refer after 6 weeks? So what happens then?
Absolutely. So somebody can re-refer if they feel that support has been so valuable. Again, you can repeat those steps and you can re-refer yourself to the programme. So you would simply, again, call that number 0808 196 3646, or you can go onto the website and you can re-refer yourself at that time.
Mags, I'll let you into a little secret as well. Our team often get in touch with people whose support is coming near the end to offer them that opportunity too. So we want to make sure that people get what they need, and we will try and get back in touch with people.
So I think on behalf of myself, Jen, Sarah, and the rest of the NHS and Care Volunteer Responders Programme, we'd like to thank you for joining us today. We hope that what you've heard has inspired you to think about who the programme can support, or how you can support the programme via volunteering yourselves. So on behalf of ourselves, thank you for joining us, and goodbye.